really, really grateful to you, ma'am. And Dr. Gourie Devi needs no introduction. She is an eminent person in the field of neurology and currently holding a position in as a chairman of neurophysiology at Gangaram Hospital. And earlier also she has held a director level of position in NIMHANS, Bangalore as well, and other many awards and other positions. So we are really fortunate to have you here and to share your guidance for the queries we have from the ALS point of view, from patients and caregivers. So there are various patients and caregivers who have joined today. A lot of people. Thank you, ma'am. Over to you.
Thank you for calling me for this meeting, and I'll be quite happy to answer any questions. If we know them, there are many unknown things in this disease. Okay. So now somebody will ask a question, or?
Okay. Reza, you are there?
Yes, Satinder,
okay, Reza,
I can share my screen and so that I can proceed.
Or maybe you can ask the questions and we can take it forward.
Okay, sounds good.
One by one.
Okay.
So I'm.
Okay, hello, ma'am. So the first question actually is: are there any medicines which can help with swelling and low jaw stiffness?
Little louder, please. Your voice is muffled.
Okay, 1 second. What about now, ma'am? Are you able to
now it's fine. Now it's better.
Okay, so the first question is actually asked by one of the caregiver, and the question is: are there any medicines which can help with swallowing and low jaw stiffness?
With swallowing, yeah?
Yes, yes.
You see, swallowing defect occurs because of your muscle weakness, which are concerned with the swallowing mechanism, like the tongue, the palate, and some of the pharyngeal muscles. Okay, so that is a part of the motor neuron disease. Now, there are no specific medication, but there are simple things which you can follow. For example, taking semi-solid food is better than like chapati or rice. It could be like in the form of khichdi or soups or milkshakes. They are easy, slightly easier to swallow. And then, sorry, to bend the forehead like this, the head, and swallow. Take small sips every time, not large amounts, because that will induce coughing and choking sensation. And try to take small feeds and with the head bent down. That's one. And the type of the food which I mentioned. There are no specific drugs. Of course, some exercises can be given for the muscles of the tongue, the throat. Usually the speech therapist, they help you, or the ENT surgeon. You okay?
Okay.
This is your patient, or?
I'm sorry?
You're the caregiver. Is your family or somebody else?
No, ma'am. So the question which was asked, this question was asked by Gaurav. So Gaurav is actually the caregiver, and he is actually West Bengal.
Yeah. This is from Calcutta.
Yeah, he is from Calcutta.
So he's there in the group in this meeting as well.
Yeah.
So
okay. So that is the way to do. And if it really becomes very difficult, then we have to think of other methods like PEG, you must have heard of percutaneous endoscopic gastrotomy. That is passing a tube and make a hole and put a feeding tube. That's when patients cannot swallow enough adequate amount of food, that may be necessary. Sorry.
Okay,
so basically, there are no specific
no specific medication as such. Sorry, 1 second. Yeah. no specific medications except for the technique of swallowing and then the type of food. These are the things which help. Many people do manage because they tend to postpone the peg, you know. Though it's not, many people are accepting it, and weight loss and other things can be prevented if enough diet is taken.
Okay, ma'am. There is, I think this is a common question from everyone. So, what is, like you are talking with and also dealing with so many patients in MND, and anyone has shared with you any benefit of ibudilast or endeavoron, which is currently people are, besides Reluzole, people are trying.
I know there are combinations, there are some trials going on with this drug. Initially, they started with 60 milligrams, okay, 2018, and then in 2019, April, the trial started with 100 milligrams, along with Reluzole. Okay, now 9 months, they said they will see phase 3, phase 2B and 3 was the thing. And they are looking at the scoring system, ALS, FRS score, what we call. And few conditions they mention that the person, illness should not be very long. It should be less than 1.5 years. And they're talking about mild to moderate degree of disability. So you're not talking about a severely affected person taking this drug. I hope made myself clear that in an advanced stage, when a person 4 to 20 or something, it may not be helpful. So the conditions for the trial are duration less than 18 months and the score about 35 out of the total of 48, mild to moderate. So this is also, it improves the neurotropic factors, supposed to be improving the conduction in the pathways, and also suppressing the immune cells in the CNS. These are general mechanisms, and it could be used in other neurodegenerative disorders also. There are some trials going on. So one must appreciate that this is not a very specific drug. This is supposed to slow down the process. Nobody is really claiming it cures. Even the trials they claim, we are trying to see whether it can slow down the process. I think 2 patients possibly are taking, but they have not reported to me. Maybe it is slightly slow. It's very difficult to make out, But I think they were quite advanced when this treatment started.
Okay.
I know this question has appeared in the list which you gave me, yes.
Yes, I think many people in our group are trying endeavoron and imbutilast as well.
Correct.
So
but you have to import it, isn't it?
Yes. So what kind of supplements you prescribe for MND if somebody comes to you, which you have seen has benefited them in progression?
See, general supplements would be initially the diet. Okay, slightly high carbohydrate diet and high protein diet helps in maintaining the muscle mass and the general strength. Muscles are wasted, so there's a lot of thinning as we find. So that might be helped by taking high protein diet and high carbohydrate, provided they don't have other diseases. If there's diabetes or something, other comorbid illnesses, you have to consult a dietitian then how much to take. This is as far as the diet is concerned. Then vitamins can be given, vitamin B1, B6, B12, CoQ 300, and vitamin E, vitamin C, all these can be tried. Again, one must realize nothing is very specific. Sorry, something happened? Hello?
No, ma'am, it's fine.
No, we
Fine.
can hear you.
You
Yes.
can hear me. So what I was trying to say is multivites, B12 particularly is helpful. Vitamin C, we give vitamin E also because it has the antioxidant properties, and something to strengthen the mitochondrial, so CoQ 300. These are the usual supplements given. Whether how much they help in the disease, one cannot be absolutely certain, but it generally improves the general health. Because their intake is limited, they may go into vitamin deficiencies, so this helps.
I
Some
think that
people are taking lot of these other supplements. You know, if you look at the list, there are numerous. Whether they are really helpful, it's difficult to say. Very difficult to say. But I would say that usual naturally occurring food substances also occur, like vegetables, salads, and milk. People are taking eggs, or if a non-vegetarian, chicken soup, etc., which is a protein diet.
okay.
These are the usual things.
Okay, so there was an earlier study, if I remember, there was a vitamin D deficiency also been noticed in ALS patient largely. So would that study
I
is
should have mentioned that vitamin D is being now given for a variety of neurodegenerative disorders, including Parkinson's and all that. And we know that Indians somehow, it is surprising, all of us seem to be deficient, including number of us doctors when we get our tests done. What is it? One cannot say. Maybe exposure to the sun or intake. So, sorry, I always give vitamin D to all my patients. Calcium and vitamin D, periodically keep checking up. Vitamin E helps in, people get cramps. Many of the patients with amyotrophic lateral sclerosis, they complain of two things. One is fasciculations, other is cramps in the muscles. Somehow vitamin E seems to help them. Calcium and vitamin E. Yes?
a good point you made, that vitamin E and this vitamin D also. So I think cramps, I think last couple of weeks, there are a couple of various people who have shared this kind of problem in the group. So there is
Every patient who comes to me in ALS, I always ask them, because many people don't think it is related to their illness, that cramps. They ignore it. So I say, nas ke upar nas chadta hai. That's the classical way of asking the patients. They say yes. And particularly when they are lying in the bed in the night, they complain a lot. Okay. So this seems to help.
okay, great.
I'm sorry,
Thank-
Satvinder, for
Please go
interrupting.
on.
So, speaking about vitamin D, somebody asked what should be the dosage limit and what medicine should be given.
We have to look at the values, vitamin D value, by doing the blood test and the calcium. Usual calcium, you give 500 milligrams calcium, and vitamin D, if it's very low, then we have to give once a week 60K. Vitamin D preparations are available, Uprise D3 or Calcirol. These are given once a week. Continue for about 3 months, then again check the values. If necessary, repeat the course. And of course, supplement the diet with milk and so. But that many of us, many of the other patients also seem to be having deficiency, and it helps them. Vitamin D is strongly recommended in multiple sclerosis, Parkinson's disease, so many other neurodegenerative and demyelinating disorders. But it's good. It's a general health, so it helps.
Inserted, and what is the difference between PEG tube and Ryle tube, and which is better?
See, PEG tube is inserted. There is external opening is there. You have to feed it through that tube. Okay. Whereas Ryle's tube, you put it through the nose into the stomach, and you feed it through the tube which is coming out of the nose or the mouth. Okay. So it's and you cannot keep Ryle's tube for long. You will have to remove it first after some time. So Ryle's tube feeding is done for many people. any other illness. PEG is given where the swallowing is defective or there's some obstruction in the pathway of the food going in. Okay? Right? You might see long tubes, rubber tubes, that's called the Ryle tube. Whereas the PEG has a small little tube, this much, which is put in the stomach, and you can see the outlet outside.
Okay, thank you.
Clear that both are different, exactly. And the PEG is you pass the endoscope, and through that they insert this tube. Endoscope is through a tube. Okay.
Thank you. Thank you.
Okay.
Okay, so there's a
One question,
Yes.
Please go ahead.
ma'am. One question regarding methylcobalamin.
That
Whether
is
we are
B12. No, methylcobalamin is B12, vitamin B12.
yes, ma'am. So we are giving 500 cg. So whether it is sufficient or we need to give some injection. Whether it is
Is the patient diabetic also, by any chance?
no, ma'am.
No, only motor neuron disease. Is it? Yeah, you see, giving orally, the absorption is not adequate of methylcobalamin. If you wish, you can give injections for about 10 injections and see if the patient feels better. But just as a mild supplement, you can give. If the levels are very low, you do the blood test. If the levels are low, then you give a course of injections followed by oral tablets. Usually for diabetic neuropathy, we give them, or due to any other nutritional deficiency, people have peripheral nerve involvement. They have numbness, tingling in the feet, particularly diabetics. This is a very important symptom. It's how much gets absorbed and goes into. You are muted by host. Something is.
No, ma'am. She's on unmute. Anjali,
Okay.
she's unmute.
Ma'am, one more question regarding ashwagandha. Ma'am,
Ashwagandha. Okay.
initially you have prescribed. Ma'am, we are from DRDO. Anjali here.
Okay. Right. Okay.
Ma'am, ashwagandha we have stopped right now. So should we continue ashwagandha tablet? The stress come and you have mentioned earlier.
Prescribed by the Ayurvedic doctors for a number of neurodegenerative disorders. Okay, they are giving for Parkinson's disease. They are giving some for behavior disorders also. It's again one of those non-specific things. I was, after listening to the Ayurvedic expert in Bangalore in one conference, when they were talking about Parkinson's disease, I said, why not try for this also? It's a neurodegenerative. But people can tolerate, they can take. But some people have complained of gastric discomfort. Then I said, you stop that. No harm in giving. It's supposed to build up your immunity. I mean, there are a lot of claims for ashwagandha. It's supposed to be a very good sort of medication, strongly advocated by the Ayurvedic doctors. If you're not finding any side effect, you continue, no harm. After all, you are giving so many supplements. This is also like a supplement, isn't it? Yeah.
Thank you.
So there is a question from Swaroop in the chat. I can see. Is there any relation between Parkinson's or ALS? Have you noticed in your patients?
Very important question. You see, there are now called the overlap syndromes. That is, on one hand, you have pure amyotrophic lateral sclerosis, ALS patients. There are others who have ALS plus some cognitive disturbance, memory impairment, behavior impairment. We call them as frontotemporal dementias, ALS, FTD. Then there are ALS with Parkinson's disease. I have patients, I've talked about this, we call this overlap syndromes. Now, the knowledge in this area is progressing very rapidly. Maybe there may be certain commonality of pathology and pathogenesis, how they are occurring. And one believes that some genes also are shared between ALS and the frontotemporal dementia, FTD. Parkinson is not similar in terms of genetics, but pathology wise, changes wise, there is an overlap. Yes, I have seen few patients, very rarely, but we do ask, any other symptoms. While examining also, we look for symptoms and signs of Parkinson, like tremors, or slowness, or postural change, etc. Rare, but it occurs. It's well known. Overlap syndrome, the word is overlap syndromes. And so also we ask about memory. Some patients and the relatives say, Madam, why are you asking this question? I have only weakness of the hands. Then I explain to them that more and more science has discovered and a lot of observations have come that frontotemporal dementia, certain parts of the brain also are affected.
Yeah, thank you, doctor. I am 44 and my mother was a doctor herself, and she had Parkinson at around the same age, and I am diagnosed with MND bulbar at same age as her. So I asked the question.
Yes. You see, there are, when we take the history of the patient, we also ask about the family. Is there any family history of dementias, like Alzheimer's dementia? Is there any evidence of Parkinson? Now, all these come under the broad term of neurodegenerative disorders. So there is, maybe as time goes on, we may find some common even treatments, possibly. That's what we are thinking of. For example, Riluzole, if you know, it started as an antidepressant actually. Later on only it was used for ALS. Surprising. Now people are thinking that it may be used for other disorders also, because we are looking at the fundamental mechanisms in the brain. Is it oxidative damage? Is it mitochondrial damage? So at the basic cellular level, maybe similar changes must be occurring. Of course, the target organ may be different. In ALS, it's the anterior horn cells or the pyramidal tracts. In Parkinson, it's a substantia nigra, basal ganglion. Right? In dementias, it's the cortex. So while the targets are different, maybe one is thinking that are we going towards a hypothesis where it's a spectrum of disorders? A good question. You are situated where, in which city?
In Bangalore, close to Nimhans, Jayanagar.
Jayanagar. I lived there for 25 years in Nimhans campus. Quarter number 45 was my house. Later on, I was the director vice chancellor from 1997 to 2002. After that, I moved to Delhi. So Nimhans is like my karma bhumi.
Okay, thank you so much, ma'am. Thank you for answering that question. So there's another question from Mayank who says that there is a heaviness in legs. What could be the probable reasons?
Heaviness.
Heaviness. I think that's a foot drop kind of situation. Or
Mayank,
if you want to add anything?
No, what were the findings by the doctor? Was there a lot of atrophy, thinning, or was there stiffness? You see, two things occur in ALS. One is what we call as the lower motor neuron disorder, where you have fasciculations, atrophy of the muscles, and the weakness, of course. Other is upper motor neuron signs, where the limb is stiff, and with the hammer we see there are exaggerated reflexes. So both these contribute to the symptoms of the patient. So I don't know what that heaviness means. Was there more of spasticity? We use the word spasticity, or is it because of the weakness?
Okay. Thank you, ma'am. Thank
So
you.
we should know the clinical findings
Right.
before one says the cause. Incidentally, you have to exclude other comorbid conditions. Many people at that age also have diabetes. So diabetes can also cause some weakness of the muscles. Weakness due to secondary to the nerve involvement. So please let them check these points.
Yeah, the person is in Delhi itself, so I'll ask. I think he dropped off, maybe due to some network issues, so he may join in.
He can send a mail to me. I can
Okay.
because I won't be going to the hospital till another month or two.
No, please,
We are
remember.
advised because of the age factor not to come
Yes,
at
ma'am.
all near the hospital.
No, you have made this hospital, the online consultation is also possible. So you are actually serving the community
Yeah,
with
that
this.
we are doing.
Thank you.
That I'm doing. Patients through emails or WhatsApp, they contact.
Okay. So there's always questions about the Felgum, means the medications available. So is it right to take medication for the Felgum reduction or
Sputum collection, you mean?
sputum collection in the mouth, right? Right.
Phlegm correction. Yeah. You see, like any other disease, there may be a phlegm formation because the lung expansion also gets limited because of the chest muscle weakness. There could be some difficulty there. So the cough is also not powerful, no, not strong like the usual people because of the weakness. So there may be phlegm. So any physician can give bromohexane or ambroxol or any of these medications to make the phlegm thin, which can come out.
Okay. So the motive is to make the phlegm thin.
Thin, so that yeah,
Okay.
it can be taken out easily, coughed out easily. And also the posture, you know. I mean, if you tell the physiotherapist, they will put the patient prone and let them cough out and the phlegm come out. There are simple maneuvers which can be done.
Okay.
And of course, these medications help. You must have heard bromohexane, ambrodil, all these are given for making the phlegm thin.
Okay. Thank you, ma'am. So there's a question from Shilpi. Shilpi, if you are there, please raise your hand in the chat. So she's asking due to unavailability of basis alicium, leave to benefit currently cause of lockdown. Suggest good replacement for that.
Supplements, is it?
Right. Again, I think we discussed this earlier
We
also.
discussed already. I would say go with natural supplements, you know. Protein X is there, soya beans are there, you know. People who are taking non-veg, they can take some chicken soups. Vegetarians can take, you know, dals and all these soya can be taken. Because one doesn't know all these supplements, what they really contain. I'm not sure.
Okay, thank you, ma'am. So Rajiv is there in the call, right? So Rajiv, if you want to ask your question yourself, so he's from Delhi itself.
Okay.
So, like my question was like, I find my mom now going on BiPAP for 10 odd hours. Okay, so what is happening if like secretion? So it's very difficult. How do we manage that secretion also and BiPAP also? So that is my issue right now.
I think these two sisters have managed very well with their mother.
No doubt.
From the intensive care. Can you not both advise him practically what should be done?
I think these sisters had the tracheostomy done. My mom is only on BiPAP right now. And she's,
okay,
yeah.
I would suggest best is to consult a chest physician. Okay. As a neurologist, we don't deal directly with these things. Okay. It's a chest physician or the critical care person to any hospital nearby, they will be able to help you how to manage the BiPAP and the secretions. Okay, sir?
Okay, ma'am.
Thank you, ma'am. So I'll try that. We'll have a respiratory specialist also, as you advised yesterday also in our call. Yeah. Dietitian, respiratory specialty.
I would suggest a good physiotherapist, a dietitian, a pulmonologist or a chest physician, and a gastro.
Okay. Yeah.
So, you know, all these people contribute to the goodness, the wellness of the patient.
Yes.
The small matters if you talk, but for the patient, it matters so much, you know. You
Yes.
cannot swallow or
It's all kinds of, I think it's everything is related to management of various kind of symptoms,
You
basically,
see,
you
that
know,
is why the ALS teams is a multidisciplinary team.
multiples.
Yeah, starting from the neurologist, of course, becomes the central portion. Because that's the person who diagnoses the case and knows the progress and medication. Other important is the physiotherapist. And as time goes on, the chest physiotherapist, the chest person, a pulmonologist, then gastroenterologist. Sometimes, very rarely, if they go into depression, psychiatrists may be necessary, but most often neurologists manage that slight amount.
So ma'am, there's another question from myself. Okay, just for benefit of all. Like most of the time, I have seen in the group that people are going through a depression. Like in case of my mom, also she is starting like biting. She tries to bite because from the time the voice is gone, she is more depressed. She is not happy at all. So what kind of medications? Like I did talk to one of my neurologists, and Nexito 10 was advised. So if you could just give a help on that.
It is, one can understand if somebody has a disease, cannot speak, cannot do on their own, depression would occur. So we have to check what are the symptoms of depression. Do they cry? Do they refuse to have food? Is the sleep disturbed? You know, then you can give a medication. Simple is Nexito, is a mild antidepressant.
Okay.
Give 5 milligrams per day.
Yeah.
Then it helps. Other thing is, you know, people who are literate, give them this iPad or the tablet, Samsung tablets. So many people are able to communicate through that. You know, communication becomes a very important thing. How do I say, I'm feeling hungry, I want to go to the toilet? How do I? And every time one cannot write, and if the hand muscles are weak, we cannot communicate. But the touch may be still there, you know. So all those people who know any language, literate, they can try this. And many people are using them for communication, and that makes them happy, you know. Please do try.
Yeah, we are using, many patients are using eye trackers also.
Eye trackers, yeah.
Yes.
That is more advanced thing, yeah.
Yes. So, from your point of view, is there something research which is going on in India? Because I'm sure you must be involved if something would of that sort would happen in India. So something is on ALS front, if anything is stem cell research or any kind of research which is happening.
See, basic research has been done or being done also even in NIMHANS in the Department of Neurophysiology, but that is on the cell culture models, you know, in the animal lab, on the tissue labs and cultures. Okay, we are looking at the sort of genetics part. We are trying to look, are there any particular genes, particularly in families, you know, who have more than one patient. There are very few, as I mentioned. Or the Indian genetic pattern is different. Okay. So one could look at the genetic profile and see the course of the disease. You know, some people develop very fast. Some people take many years to go into that state. You know, we are looking at some of those things. But treatment point of view, I don't think any research is being done.
Okay. So is there some way where Indian patients can participate in the trials which is happening outside India? Like we have neurons, we have QATCM and MX0035, that kind of drug trials which are happening outside.
See, if you look at their, like neurons I've seen, they say the patient they take from US and recently from Canada they have started, because they have to follow them up regularly, and so it would be difficult. There were some Indian patients settled in US, they asked, but even they could not enroll themselves, you know. So I think you will have to wait. Anyway, the results should be available by sometime this year, particularly the intrathecal injection of the stem cells, neurons stem cells. Okay, so we have to see. But all these, please do remember, enthusiasm is good. As we say, the hype is gone on for long, but you also get a little disappointed that we expect cure, it doesn't happen. Most of these therapies maybe are to slow down the progress, okay? Not arrest the disease, one cannot say. Even Edaravone or Riluzole, it's recommended in the earlier stages to slow down the progress. I think all of you are aware of these things. The
Yes.
cure, like, even in a disease like Parkinson, there are treatments. The treatments improve the symptoms, but the disease is progressing. I think some of you might have some members in your family with Parkinson's disease. Of course, it takes very long, sometimes 10 years, 15 years. Ultimately, they become bedbound or whatever. Because we are not changing the damaged cells. What we are doing is to control the symptoms. I hope I'm clear in that.
Yes.
The degenerative process is continuing. Alzheimer's dementia is one classic example. You give drugs, maybe there's slight improvement in the memory, the way they carry on, but it doesn't stop the disease from progressing. So I'm of that opinion. Of course, it's very nice to think something dramatic would happen, but at least if it slows down the process and the person is able to take care of themselves, that itself is a big achievement. For a person who cannot lift up the hand, if they could lift and put the food in the mouth, that's a big achievement, isn't it, for the person concerned? So even that amount we'll have. That's what they are looking at. All these scales, ALS, functional scale, etc., is looking at the ability. Many actions are put in there: cutting vegetables, feeding yourself, clothing yourself, changing sides in the bed. There are questions like that. So that is what people are looking at with all these various treatments.
Okay.
I hope I have made.
Yeah. Thank you.
So you have a score before starting the treatment and at periodic intervals, and see how the scores have improved.
Okay. So can we do as a group, can push this thing, a research from India? What can we do from our side so that the some attention would come in ALS field of research in India? So we have seen all other countries are doing a lot of research, but maybe they are money-minded people and they want to delay the cure. I don't think so that the main motive would be, but yes, the kind of even the funds which goes into this research of ALS outside the world. So this is huge amount. But while in India there is nobody, no team of doctors, no scientists. I know you are taking so much of efforts for the ALS. You were saying that day when I met you, you were sampling the blood for all the patients.
For the genetic
Is
test.
it something which we can form in India, a team of doctors who can help to find the cure for ALS particularly?
See, cure is a very big word.
I know, maybe that as specific medicine.
People interested in ALS, well, the group at NIMANS and myself and my team here, some Delhi IIT people have done some work on genetics. Okay, so basic research, some people very few people are doing, because the attractive are like studying Parkinson's disease, epilepsy, large number of patients, and there are some drugs to offer, So unfortunately, this comes under rare disorders. I think we discussed about that. And a lot of money and very advanced laboratories, sophisticated technical issues are there. And money is, of course, enormous. But you're right, somewhere along the line, more and more people should get interested. But you know, there are just about 2,000 neurologists in this country. And if you look at the patient population, epilepsy, strokes, you know, paralytic, I think all of you know about sudden paralytic episode, people who have got hypertension, diabetes. There they are doing immediately injecting enzyme, blood clot buster. So a lot of work is being in that, you know, because you get a patient within 3 hours, 4 hours, inject, and you see so much of improvement. So rewarding, both for the patient and for the doctor. Here we cannot expect like that. You see, it's a very slow process. And neurodegenerative disorders take slightly a backstage when we look at various other diseases in neurology, like infections of the nervous system. Then epilepsy, of course, attracts a lot of things because so many people are there in the country, the patients. You know,
Okay.
one
So I
person.
think, thank you, ma'am. Thank you for
But
sharing
one
this.
hopes, I keep talking,
Yeah.
I keep talking, you know, and then you have to spend a lot of time for the patient. You know, many issues are there outside the disease understanding and all that. As you mentioned, starting from speech to the diet which you take, how you take, which route you take, how you breathe, isn't it? And we haven't talked much about physiotherapy. How do you transfer the patient from the bed to the chair, from the chair to the toilet? All these are issues, practical issues. I think some of you are already doing it very well. Again, needs a lot of support, isn't it?
Yes.
Appliances are necessary. So what people can do is, another thing which I would like to mention, people have a neck drop. Some patients have come and they tell me, or the relatives, that while the patient is sitting, the neck drops like that. That makes it worse, you know. So, you know, designing a collar, proper collar, those things can be done, which if it is too hard, patients don't want to wear. It should be nice, soft, and at the same time support the neck. We have written about it.
Okay.
Yeah,
So I'll take
drop,
your help to move forward, to push, I think, this.
So you can, instead of taking cure, can we talk about how to improve the speech, how to improve communications, how to improve breathing, how to improve mobility? You see, these are issues which are there, where your engineers, technologists can help a lot. That is where I think we should be focusing on. If there are very brilliant youngsters and faculties in the IITs who can do a lot, I'm sure. Only thing, we have to get them interested. Tell them a problem. This is what we need.
Yes.
Speech. How do we improve? How do we take care of the speech? So you need a good speech therapist, you need a speech pathologist, and a person with a technological background. So let us start looking at what the patient faces, you know, from the morning till night, what all happens, what all we can help. A device, you know, appliances. I would say give a lot of importance to that. You know, long ago, I had a patient who used to come to Bangalore from Goa. And the way he designed, he was a marine engineer, the father, and he had like a cloth made like this. The patient will slip into that. There's a frame, it lifts it and puts the patient there. Fantastic. He could do it on his own. So maybe people can start doing some things. Then it can become commercialized. Even simple things like holding a spoon. If the spoon has a thicker handle, it will be easy to hold rather than the thin. A pen with a thicker thing which you can hold, you can write better. A comb which has a long handle can be used. Can we think of such simple things?
Yes, right.
Yeah. Please, each one of you think what can be done. You know, now you have seen with the COVID, there are a lot of technological innovations. I don't know if you have seen. The stethoscope normally has a small tube. somebody in somewhere in a small hospital that had a long tube so that he could stand here and
Right.
3 raise the patient. But he did still the auscultation of the lungs, the heart, and did that, you see. So innovation is what I'm talking about.
Yes, true, true. Rightly said.
So
Yes.
please do apply your mind, each one of you. Many of you are highly educated, you know what the things are happening, contact. So research in that way can be done. Okay.
Yeah,
That's
yeah.
what.
Thank you so much, ma'am. So I'll take last question. I think we have already taken, we discussed for 30 minutes and we have consumed, I think, more than 1 hour.
No
So
problem.
that Prashant is asking, I think we'll take a last question from him.
Yeah.
Prashant, you like to ask?
Yes, ma'am. Namaste, ma'am. I am from Bihar.
Ji,
Ma'am, my father died due to brain aneurysm.
brain
Now
aneurysm.
my younger brother, aged 29 years only. Yes, yes. Now my younger brother, aged 29 years only. He has been diagnosed with MND 1.5 years back. Even we have consulted you also, but since we are from Bihar, we cannot go back up to you again. So is there any correlation between brain aneurysm and MND? Is it any genetic disorder in my family?
No, aneurysm is an abnormality of the blood vessel because due to weakness of the blood vessel, maybe from birth, whatever, then it becomes a little protuberance like this, which can rupture and then it bleeds. So that is totally different. Now, he's very young boy. You say 29 years, is it? 29?
Yes, 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 yes.
Years. Young age, okay. That motor neuron disease is an independent disorder. It has nothing to do with the aneurysm. Maybe just a coincidental in the family. So
Okay, ma'am.
how is he managing now? Is he getting Relutor or is not getting?
Yes, ma'am. He is taking Riluzole,
Yeah.
and we tried everything Ayurveda, homeopathy, nothing working. Now he is on bed, and even you had advised some test. I forgot. Remember anti-immuno something like that. We did that test.
Anti-ganglioside antibodies. Yeah?
Yes, 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 yes,
Yeah.
yes, yes.
Yeah.
You had prescribed us. We did that test, but result was negative, and somehow we could not get back to you since I am from Bihar. And this is the issue, ma'am.
You see, why we ask is there are what is called as a mimics of ALS. Mimics means there may be some other diseases which look so much like motor neuron disease, but may be treatable. Okay, that may be 1 in 1,000 chance or 1 in 10,000 chance, but we look for it, like looking for a needle in a haystack. Occasional patient I have found, particularly the younger people, who diagnosed as MND but did not turn out to be MND because of this antibodies presence. That's why we look for it. If it is present, we give a different treatment called intravenous immunoglobulins. If it is not present, we don't give any particular treatment. Anyway, continue
will get back
and keep his muscles active, keep moving the limbs, and he should be made to sit up with support, stand with support if he can do, and breathing exercises are very important. Okay, I think all this we must have told. If you still have
we will get back.
You can send an email to me with the scans of the patient. I can reply to you. Okay?
Yes, ma'am, definitely. We will get back to you very soon.
Yeah, thank you. Thank you.
Okay.
Thank you.
So Gaurav,
thank you very much, ma'am.
Thank you, ma'am. Thank you so much. I think there is another question from Gaurav from Calcutta. He wants to ask about the pseudobulbar palsy. I think he's there. He can ask the question.
Good evening, ma'am. Thank you for spending time with us. I'm sorry if my connection goes away in between. I'm having some connection issues. I just have a quick question.
I'm not seeing your face though.
Yes, ma'am, because if I start my video, I think my connection will go away. Because of the cyclone, the connection is a bit...
Okay, doesn't matter. I'm able to hear you, so that's fine. Tell me.
I just have a quick question. My father has bulbar symptoms for about 20 months now. and he's yet to develop any symptoms in his limbs. And this is as per our last EMG NCV test. I'm just trying to understand, whether it could be a pseudobulbar palsy as his condition, or is there any way to find this? And specifically right now in COVID times, where it's very difficult for us to travel to different cities, would you have, any connection, or would you know of a good neurologist in Kolkata who we can discuss this with?
Okay. Now, has he undergone EMG nerve conduction?
Yes, ma'am, thrice now.
Thrice now. Who has done it? Which hospital?
We did it in Bombay. We did it at Jaslok, and then we followed it up at CMRI here in Calcutta.
CMRI. Okay. There is a National Neuroscience Institute, no?
Yes, there is a Institute of Neurosciences. Kolkata,
Institute
yes.
of Neurosciences.
Yes.
A very good neurologist, Dr. Rishikesh. Rishikesh is name.
Rishikesh Kumar, yes.
Kumar. Yeah, you contact him. You see, the way to differentiate bulbar palsy and pseudobulbar palsy. I will give you the difference. Bulbar palsy means it's a lower motor neuron disorder. As I mentioned earlier, that they will be twitching, that is tongue fasciculations will be there, tongue will be thin, and then when we look at the power, the tongue power will be less, and the voice also may be affected. Okay. Now, when we do the EMG, we do the EMG of the tongue muscle from below the chin. Put a needle there and see. Now, if that also confirms lower motor neuron disorder, we will say it's a bulbar palsy. Okay.
Okay.
If there's a wasting of the tongue, fasciculations, and EMG evidence. If the patient has difficulty in swallowing, but none of these are present, then we look what is called as the jaw jerk. We put the hand there and tap like this. And then if it is brisk, that shows it's an upper motor neuron lesion. That is, and then the patient generally has what we call as uncontrolled laughter or crying. Okay. That is, if some amusing thing is told, a joke, we all laugh, but then we stop. We don't continue to laugh. So, or one has a sad news, we weep, but it stops. Here it's uncontrolled, So there is not much emotion behind here, but it is the muscles which express are not able to be controlled. That is why the symptoms of pseudobulbar palsy are these, It can happen in other diseases also. In some stroke patients, when they have bilateral stroke, it can happen. So that is called pseudobulbar palsy. I hope I made it clear. And new dexta is given for this pseudobulbar palsy.
Okay. As per Dr. Abhijit Chatterjee in Kolkata, he had mentioned that it's upper motor neuron, but he didn't allude to it being pseudobulbar.
Yes.
So I think perhaps I can go to Dr. Rishikesh Kumar and just have it rechecked again.
If he said upper motor neuron lesion, that's what he's meaning, possibly. Okay. It's not a progressive bulbar palsy. It is a upper motor neuron. Okay. Does these episodes occur of laughter or crying, anything like that?
Well, not really, but recently he had a personal tragedy, and because of that personal tragedy, he did have bouts of crying, and it did take time for us to control him. So, I mean, it's not something that happens, involuntarily, but recently, because of the personal tragedy, it did happen. So I'm not sure if that can be alluded to the characteristics which you are asking for.
In these pseudobulbar palsy, when they have these bouts of laughter or crying, it is very embarrassing for the family members and in a social occasion, because the patient cannot control, but they also feel odd. What is happening? Then, India, we have the tryptomer that can be given. If it is very difficult to control, you have to get new dexta. I
I
think that's
understand.
also somebody asked a question, I think, for suitable.
I understand. I
That
understand.
has to be reported. But as what you say, I don't think that is suitable, Papa. I'll see at the moment for your father.
Okay. Okay.
Okay?
Okay. Thank you very much.
Is he on Riluzole?
Yes, he is.
Yeah.
Thank you so much, ma'am. I think you have explained it so well, and you have given your valuable guidance and your precious times to all the group members. So I'm sure there are so many other kind of questions also people might be wondering, but yes, they can contact you afterwards through email and ask the questions. And because in this lockdown time, we cannot move out, but yes, thank you for being so supportive and so grateful. We are so grateful to you on behalf of the complete group. Thank you, ma'am.
Thank you for giving me an opportunity. After all, this is what we are for, to take care of the patients and to the best of our ability to try to help as much as we can. Thank you for the opportunity.
Thank you so much, ma'am. Thank you.
Thank you, ma'am.
Thank you,
ma'am.
Thank you, ma'am.
Thank you, ma'am.